Welcome to Module 2 of the Freedom Techniques. In this module, we'll look at science. So let's review what we have already talked about. Initially, we found that guy Ötzi that was found about 5,300 years ago who had tattooed points on his ankle. We think maybe those were already acupuncture points. We don't really know. There is no science behind that. However, acupuncture has been studied and there is science to back it up. We talked about Dr. Goodhart, a chiropractor, who made the link that he was also an acupuncturist. He made the link that you did not have to insert needles in the point to be effective. You could also tap on some points. And he especially worked with allergies. Later on, Dr. Callahan, a psychologist, attended one of his workshops, and he made a connection that allergies were to the body the same as fears and phobias were to the mind. And that's how the Callahan or the tapping techniques were born. And there's a lot of science. We talked about it. There is science backing up Dr. Callahan's technique. We'll see more about this. Then Dr. David Gruder, who was married with Rebecca Meyer at the time, the Gruder-Meyer, that's where I learned about the tapping technique. He studied with Dr. Callahan and he studied with Gary Craig. And Gary Craig is the one that spread his technique, emotional freedom techniques, all around the world because he collected thousands upon thousands of anecdotes from different parts of the world. And that's how the whole world got to know emotional freedom techniques. So he got anecdotes from Australia, from England, from France, from Russia, and obviously also from the United States, thousands upon thousands, not scientific, but anecdotes. And later on, the ACEP, the Association for Comprehensive Energy Psychology, started to do real research and put research together into meta-analysis and finally got energy psychology to be accepted by the APA, the American Psychology Association. Now psychologists can learn the tapping techniques without risking losing their license. So what is true science versus junk science? That's a very important point. True science versus junk science. True science makes a hypothesis. And when I was teaching at Oli UNLV, I took that example. The hypothesis is all women love pink. Junk science would make an assumption or a decision. They would decide all women love pink, or for men, I used football. All men love football, right? And then if you do true science to test the hypothesis, I would ask my class, the women, do you all love pink? Obviously, some liked pink, some didn't. Same for the men. Okay, and in the junk science, they would test the assumption of the decision. And if my hypothesis that all women love pink is not true, because we found that some women did not love pink, we would make another hypothesis in true science and start the process all over. Not so with junk science. What would happen with junk science is the women who did not like pink, the men who did not like football were discarded out of the study. And unfortunately, that's what happens a lot in the pharmaceutical industry and especially with the vaccine industry. So be very aware the difference between true science, has it really been tested, is a hypothesis holding to the scientific method, or is it junk science where they discard everything that does not go according to their assumption, according to the decision they made in advance. So let's look at a few examples of energy changes. This was done with Rebecca Marina, and Dr. Felici, who is a naturopath. So Rebecca, if you look at her blood, those are red blood cells under live microscopy. What is live microscopy? Well, you just take a drop of your blood, it's live, you put it under a microscope and you observe. And in her case, that's red blood cells, and they all clumped together. This happens a lot of time if you eat some food that you are intolerant to, and your cells would clump together. So what did she do? She did some tapping. And you can see the cells are starting to get more relaxed and not so clumped together. And after a few more minutes of tapping, the cells were free. So the red blood cells give you oxygen, iron. If they clump together, they cannot really give you that oxygen. That's when you feel sluggish, tired after a meal. And sometimes the tapping can help. Now let's see another doctor who uses some energy work, not the tapping. She uses music actually. And that was the tip of the finger. We look at Kirlian photography. That's the energy emanating from the tip of your fingers. So this patient had AIDS, and that was before a music session, which was an energy session. And after, see the improvement in the energy in his finger. But what's very interesting too is that the therapist before the session, obviously she had more energy, she wasn't sick. And after the session, her energy improved also. So what happens with a lot of psychologists, psychotherapists, they're exhausted at the end of the day, hearing all the problems their clients or patients are having. However, if they use a tapping technique with their patient, they're not going to have that exhaustion. They're also going to have better energy and can go on with their day. So some people are wondering if the tapping technique is actually a placebo. So let's see, what is a placebo? First of all, a placebo means I please, from a Latin word. And it's using a substance containing no medication and prescribed or given to a patient to reinforce his expectation, excuse me, of getting well. It's an inactive substance or preparation used as a control in an experiment to test or determine the effectiveness of a medicinal drug. And it's something of no intrinsic remedial value that is used to appease or reassure another. And I did my PhD thesis on the placebo effect and on multiple personality. It's amazing what the mind can do. Now, this is a fascinating video I'd like you to watch. It's about 47 minutes, let's see, 47 minutes and 23 seconds. It's a video made by Darren Brown, who is a mentalist in England. I think he's fabulous. And he works with the police, he works with medical doctor, he works scientifically. He also has incredible shows in London. But he likes to check what the mind does. How can you manipulate people? He manipulated somebody to actually commit a murder. It was all fake, the gun was fake, but just to show that you actually can hypnotize somebody to murder somebody else. And he also had some people, he wasn't using hypnosis for these other people, he was using a technique called NLP, neuro-linguistic programming. And just during, I believe it was a 5-day workshop on business, he put some sentences in there, and I think it was 4 out of the 5 people committed a heist just because of what he put in their mind. So be very careful what you watch or listen to, because your mind picks it up. So you can either stop this recording and watch it now by clicking on the screen, or watch it later on. So why do I say that the tapping techniques is not a placebo effect? It works on the elderly that have no clue what you're doing. And with the elderly, you would not tap on them. You would gently touch them on the acupuncture point and let them breathe and then move on to another point. And people from different languages, when there's been traumatic events, floods, hurricanes, landslides happening in different countries, we've had some therapists go there who didn't speak the language, just worked on people and showed them how to tap to calm the stress. It works on babies. So obviously babies don't understand. It cannot be a placebo effect. And again, with babies, you wouldn't tap on them. You would gently touch the different points. Or we're going to talk about, you can do some surrogate tapping. That's coming in the advanced session. It works on animals. I personally worked on horses and on my puppy. My puppy just woke me up too early in the morning, and I tapped on going from 5 a.m. to 6 a.m. And also my puppy was afraid to walk somewhere because he had been attacked by a bigger dog. And the following day when we went back walking on that road, he just stopped and he did not want to advance. So I got down at his level and was tapping on him, tapping on, usually I do the forehead and the chest. And then he went through, and the next day I had no problem. Does it happen all the time? No, I had a hard time with that puppy. She was always afraid of big noise like thunder, fireworks, and that was a very difficult thing to work on with her. And it even works with plant. I heard a therapist friend of mine who was asked to go in a country to work on their crops. And you can work with plants. You work surrogately on plants. So let's find out what we have found about the tapping techniques. As mentioned, Dr. Callahan's was in clinical settings in hospital, and this is what was observed in hospital. Arterial plaque was reduced. Cortisol levels went down. Polarities were reversed. Blood pressure went down. Heart rate variability improved. Clumped blood cells, we already saw that, would be freed. And treatments that did not work before started to work when we work on the reversal, and we'll do that in our next session. And when he passed away, he was working on a specific sequence to help people who had malaria and was getting quite successful. So when acupuncture points are stimulated, something happens at both the electromagnetic level and the electrochemical level that has a direct influence on how you feel. Now, you may have heard about functional magnetic resonance imaging, fMRIs. It's when they put electrodes all over your skull and check in real time what is happening. And what they saw is when you do the tapping, your brain is not as stressed and the stress level diminishes. This is a scientific experiment they did doing 12 sessions combining manual acupoint stimulation and image activation with a patient who was diagnosed with generalized anxiety disorder. So you can see on the upper left, the brain, that's your ideal state, a normal profile, it's blue. And if you have generalized anxiety disorder, your brain doesn't look all blue there. It shows some pink and some red, meaning that you stress, you anxious, you panicky. And after 4 tapping sessions, you start to see some of the blue. After 8 sessions, even more of the blue. And after 12 sessions, the brain is much more relaxed. So that is a scientific experiment that has been repeated with other people. So it does change the brain. And you can click here to read the whole article. ACEP, we talked about ACEP, the Association for Comprehensive Energy Psychology. There are over 400 identified forms of psychotherapy. Did you know that? I was surprised to learn that. Many of which have little or no research to validate them. When I was studying psychology years ago, we were told that we could help 25% of the people, 25% of our clients would get worse, and 50% would have no change. Energy psychology is both evidence-based and in the top 10% in terms of published research for psychotherapy modalities. So it's been researched. The tapping techniques are not just a woo-woo thing. There is some scientific validated research behind them. I'm not going to read all that. There's over 200 studies, review articles, meta-analysis. What is a meta-analysis? Is when you put different research analysis together. It makes a big meta-analysis, have been published in professional peer-reviewed journals. EP has been scientifically proven to work for anxiety, depression, food cravings, pain, and trauma and PTSD, and anecdotally for hundreds of other issues. But anxiety, depression, food cravings, pain, trauma, and PTSD have scientific validation behind them. So many unexpected positive side effects have been noticed by many people. We're going to learn more in our next module.